Hello, I'm back. Sorry, it took me a bit of a while. Ben needed me. Anyway, I'm going to show you now how to connect that tube in that I bought in earlier, which over here, I sterilised this earlier too. Just normal stuff. You don't need anything major. Most people who are on ventilators would already have all this stuff. I've had to re-gown up, by the way, so I've got to re-glove up, so I'll try and put these small ones on. No, sorry, green ones, because I need to use small gloves. So what I have to do is to use these ones, which are always a pain in the bum sometimes to get on. Should have cut my hands properly. Look at me, struggling. Well, this is the first time I've done it on camera, so, and I've not trained for quite a while, so you know, haven't lost my touch. I was just like a little bit nervous at showing things like this on video, so it's kind of like, ooh. But most moms and dads have more practice because I've only just took over Ben's care for now. Hopefully we can get things sorted there. I always do that to my gloves. Anyway, cut my hands. So what I'm going to do is I've got the bag and it's all on sterile, so I'm just going to split open the bag. I don't care now because I just can't wait for it to be connected. So all around this area here, I've got it all sterile. I don't know whether you can see, but I'm just going to top up his water, which I can touch anything because it's all sterilised, like I said. So I'll be as quick as I can. So I've just used normal gauze. You can use cotton wool, you can use anything. Just any old fashioned household, anything to keep gauze. Like I said, even paper from your sterilised gloves. Anything old fashioned. I'd want to give you rather the old fashioned chips, not chips, but tips, rather than not. So anyway, this is what I've used over the top. So I kept it sterilised anyway. So like I said, you can use this. This was sterilised though, and it still is at the moment, apart from that little bit of touch. Anyway, get on with it. Add my tube in, which I will now. I've got the mask there. I'm going to do non-touch technique as much as possible. And keep the tube in as clean as I can. I'm going to connect there. Do you know what? Bring it the wrong way now. You can see that I am a little bit nervous, but it's only because I'm on this YouTube. I've done this for years and years and years. In fact, 30 years of my life. So, you know, it's just a little bit, I'm trying to give it the old-fashioned technique. So, anyway, look. Bag. Absolutely everything. If you can see that, easy peasy. Right, later on, I've got to cut some sort of tubing up for it because I've been having little issues. No, it's not going on. So what I'm going to have to do is do another technique and come back to this video again. Gloves off. This is tempting my patience. However, you know what? I'm just going to laugh about this one. Just keep everything sterile. Right, you know what? I should have thought of that 20 minutes ago. And I didn't. Oh, thick or what? All the years that I've done things like this, repairs on machines and equipment, and I feel sick. But I just don't care because mistakes are always made, especially when I've only just come back into the care when I shouldn't be doing it. Anyway, let's not moan about that. Let me go and get my bits that I need and come back sterile again. Sorry for this.